Hi friends, this is step 3. In this step, we are trying to talk about how severe is your diabetes. So, when I ask you this question, how severe is your diabetes? Most of you think that I'm just asking you about your fasting blood sugar levels or postprandial blood sugar levels or maybe HbA1c and nothing more than that. But in reality, these fasting blood sugar levels, postprandial blood sugar levels, HbA1c are good to know. It's good to know about these specific things, but there are other parameters which can give more insights, which can give tell more about what are we doing wrong, what are we doing right, and they can also give us direction to correct our lifestyle or maybe diet and all, and to improve our diabetes. So let us understand what are all the tests which are very very important to understand how severe is the diabetes. So let us come to the first test, that is lipid profile, also called cholesterol profile, wherein your cholesterol readings are actually given in that HDL cholesterol, LDL cholesterol, triglycerides, then very low density lipoproteins. There are 4 5 parameters. So the most important one is triglycerides, which is like which indicates how sedentary lifestyle you're leading. So triglycerides above 150 mg per dl is considered not normal, and more than 200 and 300 is not at all good. But some of the diabetics have high triglycerides. This is one indication. And then apart from the triglycerides, we have high density lipoproteins and low density lipoproteins. So here comes the interesting part. Not all cholesterol is bad. People think all cholesterol is bad, but no. Cholesterol has different types like good cholesterol and bad cholesterol. So high density lipoprotein or HDL cholesterol is called good cholesterol, and LDL cholesterol, low density lipoprotein, LDL cholesterol is called bad cholesterol, because HDL cholesterol, HDL high density lipoproteins, they help us, they help collecting fat from all over the body towards liver, whereas LDL does the opposite. So knowing your cholesterol profile is very important. There are other markers which are like related to cholesterol, like lipoprotein A and VLDL. If they are also out of range, you should be cautious about that thing. So lipid profile you should be checking frequently. Then next comes insulin response test. So many people have a doubt like, is my body producing enough insulin? Is my pancreas working well or not? Or am a type 1 or a type 2? There is a confusion in some guys. So you can go for this insulin response test. So in this test, you will be able to find out how much insulin your pancreas is producing in the fasting state and as after food also. So insulin response test readings, I'm giving it here for your reference. You can have a look. And apart from insulin response test, there is one more important thing we all have to uh, pay attention to is vitamin deficiencies, because these two vitamins deficiency is quite common in diabetics. One is vitamin D and one is vitamin B12. So vitamin D has become recently means more people are actually having vitamin D deficiencies recently because of our lifestyles. We're living in apartments and we go to corporate offices where we don't get exposed to sunlight. So vitamin D deficiency directly linked to insulin resistance and also insulin acting on our body. So vitamin D deficiency, you have to go and get it checked, and don't check vitamin D3. Many labs are offering vitamin D3, which is not a bioavailable form, whereas 25 hydroxy vitamin D test is more bioavailable. So you go for 25 hydroxy vitamin D test, and that readings, I'm indicating the readings here again. So apart from that, B12, vitamin B12 also is very very important. B12 plays a very crucial role in nutrient absorption. So if you want to have good nutrient absorption, you need to have good level of vitamin B12. So normal laboratory ranges are like 200 to 900, but uh, good international nutritionists actually suggest between B12 ranges approximately like above 400. That is what is called. Then apart from these vitamin deficiencies, we should also try to check our C-reactive protein test, which indicates the amount of inflammation in our body, because most of diabetics have inflammation. So we should be able to check this C-reactive protein test. Then next is liver profile. You need to check your liver profile, because you need to check that also gives us an idea of how how effective is your liver metabolism. Liver metabolism is generally impaired in diabetics, so we need to check our liver condition more frequently. That liver enzymes, bilirubin, alkaline phosphatase, and all these things are there, and SGOT, SGPT, these type of readings, this all these readings are crucial. So I'm giving the readings here. You can have a look and see if they're falling under the normal range or not. So if liver profile is not good, there's maybe chance that you are having non-alcoholic fatty liver or alcoholic fatty liver or other issues. So it's very important to have liver profile checked quite often. Then one more thing is kidney profile. In the kidney profile, most importantly, the glomerular filtration rate is measured. So you can check the reference readings here. So you also need to check the kidney profile. So all this, I generally recommend people to undergo all these tests at least once a year, and HbA1c once in 3 months. Then fasting and postprandial you can frequently check. Then you can go for lipid profile once in 6 months at least. These are my recommendations. So now you can ask me any questions regarding this medical tests or what are the normal ranges and all. So now ensure that you check all these medical parameters, so that you'll know exactly how severe is your diabetes and how you can reverse it. And one more thing I forgot to mention is oral glucose tolerance test. So this oral glucose tolerance test is also very important, because if you think that you are near to reversal, or your almost all the readings are coming normal without any medications, then you can go for oral glucose tolerance test, which is like a proof that your diabetes is reversed or not. In oral glucose tolerance test, they give you 75 grams of glucose, and you bring that, and the readings are checked again 1 hour or 2 hours. Then the range is there. If the ranges are under that, then it indicates that आप लड्डू खा के भी आपको शुगर नहीं बढ़ता है. That means after eating laddu also, after eating any sweets also, your sugar will not rise. So that is called oral glucose tolerance test. So these are all the tests. So you can go for these tests and check how severe is the diabetes. Thank you for watching this video till the end. So I'll be doing much more information videos the same way. So please subscribe to the channel if you don't want to miss these videos further, and also don't forget to click on the bell icon, which will send you notifications that will notify you whenever I do a new video. And also please share along with your friends and family, so that they also can get benefited. Thank you very much. Bye.